The Trump administration is doubling down on its push to fully reopen schools across the country in spite of a surge in coronavirus cases. Education Secretary Betsy DeVos is echoing President Trump's call for a return to the classroom without any promise of federal assistance to implement COVID-19 protocols. Instead of fully reopening, many schools are planning to implement a hybrid system of remote and in-person learning this fall. For more on this, let's bring in pediatrician Dr. Dyan Hes, who joins me from New York City. Dr. Hes, welcome. It's great to have you with us. So the CDC released some specific guidelines for schools reopening, which were then criticized by President Trump. What was in those guidelines, and were they reasonable in your professional opinion?
Yes, they were reasonable, but I think that, the United States is a giant conglomerate of different states that have had different responses to the COVID outbreak. And for President Trump to say that all states and all cities should reopen schools is, painting it with one brush. In New York City, we've done phenomenally with getting these numbers down, but in Florida, they have done horrifically. And of course, we all want our kids back in school because I'm the mother of 2 teenagers, and I can tell you that having hybrid school is going to be a punishment for me beyond, and my husband beyond belief. But I want my kids to go back to school safely. You have to take each county, each district separately based on the numbers.
And I hear you, being a parent myself. It's been very difficult. The online schooling this past semester turned us all into homeschoolers. But of course, like you said, parents and everyone wants to be sure that school can reopen safely. Before we get into the nitty-gritty of that, tell us a little bit more about the potential problems of keeping students at home this fall. I know there are a lot of concerns about parents being able to get back to work, but also about the increasing, discrepancy between the haves and the have-nots, with the have-nots really suffering when school doesn't happen in person.
Right. If your parent is a frontline worker or has to go drive an ambulance or is a food worker or a delivery man, who is going to supervise you online? I have a 16-year-old who's doing online summer school right now, and he has 2 parents who are super educated. I have to make sure that he is awake, but I have to go to work at the same time, and I have to make sure that he's engaged. My husband's online working from home. So what do families do without resources, without iPads, without somebody home making sure? Do you have a grandparent? Do you want to expose your grandparent to that child? I can tell you in New York City that I have had a record number of record releases, which is people requesting releases to different doctors because my patients are moving out of state. Once they heard that there was going to be a hybrid model with no true calendar, parents can't call a babysitter now and be like, in September, I might need you 3 days a week. I might need you 2 days a week. Or I might need you 5 days a week, and I have to work. So what do? They go home where their families are that can help them.
It's so worrisome on so many levels. Of course, again, it has to be done safely. The American Academy of Pediatrics supports the reopening of schools, but it does have some exceptions. Can you tell us about those exceptions?
So when the rate is 10% and the cases are spreading high, we should not be reopening schools. But I can just tell you that I did a little poll amongst pediatricians in New York City. I sent out to 20 pediatricians who we all talk to in the tri-state area. And I said, in the last month, have any of us had any COVID positive cases? And none of us, thank the Lord, none of us had 1 positive case. This is great. This is an indication that we are doing well. And if kids can go back to school with masks and teachers can have masks and maybe they can be in smaller classroom settings and alternate days, yes, we ideally want our kids to get back to school. But I also know that my daughter is going to go to a public school that has 800 freshmen, and that there is no way that they can bring 800 freshmen and 800 of every grade back into the school at the same time. So we're going to have to make some compromises. The desks are going to have to be separated. They're going to have to eat at their station, and it's harder with younger children, and they're going to have to wear masks. And the teachers are going to have the safety equipment to protect them so they come back to work.
Absolutely. Let's get into what we know so far about the rates of COVID-19 infection among children as compared to adults. And what more do we know at this point about whether children are actually spreading the virus when they get sick, even if they're asymptomatic?
So and there are very small studies. From what we know, the children are definitely not super spreaders, but they can bring the virus home to their house. In most of the school transmissions, it's been a teacher giving COVID to a child and not vice versa. But that child can go home, and if you live with, frail parents or your parents, you might get that infection. Now, is that child going to die? Probably not, because we've seen a very low morbidity in children from COVID, which is fantastic, and that's why we want them back in schools. But, as we reopen schools, there are going to be outbreaks. Anybody who says there's not going to be is going to be very naive. And we're going to have to figure out a way to shut them down, contain them. How do we test all these kids? How do we test the exposures? I think that's as a pediatrician, that's my fear. So we're going to reopen schools. And what do you do with every kid who has a symptom of COVID, which is almost every symptom of the flu at the same time? How do we test them in a timely fashion? And how do we have a parent stay home again for 14 days? Or a grandparent stay home, or a babysitter stay home, and how does somebody go to work?
Right.
So there's so many.
So quickly, because
everybody wants answers yesterday. That's a problem.
I know. And Dr. Hes, quickly, because we're almost out of time, what do we know, though, more about those few deaths that have happened? Because as you mentioned, the cases are very few and far between of children dying of COVID-19. But do we know if there are certain children that are more susceptible to having, a terrible reaction to the virus like that?
We do know that the multi-inflammatory syndrome happens more in African American and Hispanic children, but we do not know why. We are looking for genetic markers. This is going to take years to figure out. It won't be done in the last. This is a new disease. We have other syndromes like Kawasaki that are similar, and we still don't know what causes Kawasaki. So we're going to have a while till we figure out this one. But the great news is that if we catch it early, we can treat it. And I think for a long time, people were afraid to go to hospitals. That was a problem.
Right. All right. Well, Dr. Dyan Hes, thank you so much for sharing your expertise on this with us.
Thank you.